We are talking about diseases of thyroid gland. This video is important for everybody, especially for those who suffer thyroid imbalance. You will learn which factors affect the iodine deficiency in our body and why the iodine does not get absorbed even in case it is supplemented in proper amount. Internal and external factors that have negative effect on thyroid health, and also why it is disproportionately affect female population who suffer 95% of thyroid conditions. Out of all endocrine conditions after diabetes, the most common are conditions of thyroid gland. Around 700 million people worldwide suffer from thyroid conditions. The most commonly recognized reason is the iodine deficiency. In one family or amongst people who eat the same food on a daily basis, one starts experiencing thyroid problems. The rest of the family members, however, might not have that, at least not at the same time. Isn't that logical to think that all members would have the same problem? Let's analyze. Iodine is the nutrient that is supplemented with food. Our body doesn't produce it. It is absorbed from food in the intestinal tract. Here we have to mention that if the intestinal tract doesn't function properly due to inflammation, dysbacteriosis, imbalanced intestinal microbiome, leaky gut syndrome, or other GI conditions, then the absorption of nutrients and vitamins as well as macro and trace minerals is affected, including iodine. Along the same line, we may witness the deficiency of other important elements such as selenium, zinc, iron, and insufficient levels of vitamins and various enzymes. The idea of that poor gastrointestinal function leads to dysfunction of thyroid was put forth in the beginning of 20th century. Recent study confirmed that in people with low thyroid function, the imbalanced intestinal microflora is lacking in lactobacillus and bifidobacterium strains. Epithelial layer of mucous membrane of the intestinal wall has intestinal villi. It increases the absorption of nutrients. When the membrane is inflamed, the villi is significantly reduced in size, which leads to impaired absorption of nutrients. Iodine as well as selenium are two vitally important minerals for thyroid. Selenium acts as a protector of thyroid, that is why it is so needed. Another element that is required for thyroid health is iron. Iron is a part of enzyme that is used in production of thyroid hormones. Poor absorption of nutrients in digestive tract affects yet another element, which is zinc. This is the reason for the formation of nodules in thyroid. With a deficiency of zinc, the excess of copper is not eliminated from the system. It accumulates and stimulates thyroid, consequently triggers the formation of nodules and cysts. Zinc deficiency is seen by white spots on the nails, poor wound healing, dryness of skin, hair loss, memory deficit, reduced concentration, and increased irritability. The intestinal digestion has to be well balanced and healthy in order to properly process the nutrients. Of course, there are other factors that influence the function of thyroid, but the proper intestinal absorption of iodine is the key factor. Endless amount of bacteria in our intestines definitely influence the production of hormones in the body, including thyroid hormones. Antibiotic therapy significantly reduces the absorption of iodine, as antibiotics annihilate friendly microflora too. This bacteriosis is a common problem that can be an effect of overuse of medications, including antibacterial, antiviral, antifungal medications, unhealthy eating, frequent infections, colds and flus that lead to toxins and pollution buildup in the body. With a dysfunctional microbiome, the transformational process of inactive forms of T3 sulfate and T3 acetic acid into active T3 is altered. To correct this condition, please consider correcting your nutrition and balancing the intestinal microflora. You can get the beneficial strengths of bacteria from such products as sauerkraut, fermented coconut yogurt, miso pastes, and number of fermented drinks. Or you can simply supplement it with a good quality plant-based probiotics. This takes care of intestinal villi, reduces inflammation, enhances digestion and assimilation rate of nutrients. It is also beneficial for cancer patients after chemo and radiotherapy, arthritis, and cystic fibrosis. Proper absorption of iodine and production of T3 and T4 are altered if the insufficiency of selenium, zinc, copper, and cobalt is present. Selenium is the key element. Today we know that iodine deficiency, along with deficiency of selenium, constitute the reason for hypothyroidism, as well as autoimmune thyroiditis, also known as Hashimoto disease. The presence in the body of such elements as bromine, chlorine, fluorine, mercury, and lead blocks the thyroid from processing iodine. The presence of these elements prevents the iodine assimilation by the thyroid, and it is eliminated from the body with urine even if the significant deficiency exists. In case the absorption of iodine is adequate and it gets into the bloodstream at proper amount, there is still a chance of it not getting into the cells of the thyroid gland. Prior to that, it needs to be carried by sodium iodine importers, NIS. If there is accumulation and excess bromine, chlorine, and fluorine, or all of them together, they will block the cell receptors and access of iodine into the cells will be denied. Most commonly, it is to bromine. In order to remove the excess bromine from the body, we need selenium. Selenium helps the body to neutralize and rid of not only bromine, but also arsenic, cadmium, lead, platinum, and mercury. Selenium is needed for production of glutathione by liver, which helps detox the body of bromine and mercury by binding them and eliminating from the system. Selenium, in combination with iodine and amino acid tyrosine, takes part in production of T4, thyroxine, the main hormone of thyroid. Selenium is an antioxidant and protects the thyroid from the effect of free radicals and inflammation. The deficiency of selenium leads to hypothyroidism and thyroiditis. Selenium is indicated in all conditions of thyroid. With a deficiency of selenium, the body cannot produce T4 and T3, and it is predisposed to development of nodular and multinodular goiter. The consequences of this condition is hypofunction of thyroid and Hashimoto thyroiditis. The brain, in this case, stimulates thyroid to begin increasing its activity. However, without selenium, it cannot carry out its function properly, which leads to overgrowth of thyroid tissue based on selenium deficit. Such conditions may not manifest quickly. Initially, the thyroid begins producing a lot more hormones that it needs. Then the quantity reduces and finally gets depleted as it wears out the thyroid. The deficiency of selenium is a consequence of intestinal malabsorption. Bromine, chlorine, and fluorine presence in our daily life is excessive and creates conditions that prevent iodine from being properly processed. These elements are halogen group, as well as iodine. The particularity of this group is that each of them is capable to substitute for another with a heavier atomic weight. And the heaviest of all is iodine. Iodine cannot replace chlorine, but chlorine, fluorine, and bromine have lighter atomic weight and easily replace iodine. It doesn't take much brain to understand where the dangers lurk in our daily surrounding. Chlorinated water, chloride containing toothpaste, increased amount of fluorine in water, bromine containing sedating medications, and their use in health industry, food industry, and many household materials. Bromine are used in pesticides and flour bleaches, as fire retardant in furniture, mattresses, carpets, vehicle interiors, electronics, self-care products, toothpaste, and mouthwashes. Let's talk about why the immune system attacks the thyroid. And here again, the number one reason is the intestinal tract improper function. Intestinal wall is designed to be permeable to a certain degree in order to allow nutrients to be absorbed through it. Gas, bloating, liquid stool, abdominal discomfort are all symptoms of irritated bowels and indicate serious problem with digestion and shifted microbiome, the result of poor nutrition, coffee, and alcohol. The good bacteria gets annihilated and replaced by a pathogenic strand of bacteria that is the product of external negative effect. The permeability of intestinal wall is protected by symbiotic bacteria that lines out the mucous membrane, providing only well-digested, proper nutrients to permeate into circulation. If the pathogenic bacteria strands prevail, it breaks the defense mechanism, allowing improper compounds, larger molecules, and not fully digested foods, as well as infections, to get into the lymphatic circulation, which is a part of digestive tract and immune system. Further, it goes into the bloodstream, where immune system immediately responds to it by increasing the production of cytokines, phagocytes, and other immune cells in order to fight the alien antigen invasion. The aggravated immune system response leads to development of inadequacy and inconsistency of immune reactions. As a result, the produced antibodies begin aiming at its own tissues. The thyroid tissue gets exposed to this autoimmune impact first, and the endocrine system responds to it with a hyperactivity of thyroid function. Similar mechanism is at the base of rheumatoid arthritis, in which case the antibodies pathologically affect the cartilage, the connective tissue. Leaky gut also allows liposaccharides LPS to get into the bloodstream. LPS is the component of the cellular membrane of bacteria. If the intestine is healthy and liposaccharides are simply eliminated from the body. But with leaky gut, these compounds easily get into the bloodstream and cause alteration in production of protein that is called sodium iodine symporter, we mentioned before, NIS, inside the thyroid cells and provoke the increase of iodine in uptake. Too much of iodine is also harmful. With a heightened consumption of iodine, the normal rhythm of reactions is disturbed and cause hyperthyroidism. The endocrine system begins to work in a different mode that undermines the nutritional metabolism and disturbs the hormonal balance. The body begins to view the malfunctioning organ as an aggressive alien invader that it wants to fight with autoimmune response. The immune system attacks it with white blood cells, but under this condition, the thyroid increases its function. And again, we see the problem for this vicious circle stem out from the intestinal imbalanced digestion. Let's see why 95% of thyroid cases are females. During the menstrual cycle, a female loses a significant amount of iron. Replenishment of the element depends on nutritional supplementation. So, if there is a problem with the intestinal digestion, then the body would experience a great shortage of iron. And even if the hemoglobin level may be within the normal range, the true picture of iron saturation in the body is seen through the level of ferritin. This shows the shortage of iron within the body, and if the level of it is low, the latent condition of anemia is possible. Due to the low ferritin level, the production of enzyme called deiodinase is blocked, It is the enzyme that transformed the low active T4 into active T3. Thyroid peroxidase is another enzyme that depends on iron. The biological activity of thyroid hormones decreases, and hypothyroidism develops as a result. Another reason of development of hypothyroidism is the increased level of estrogens. Some other factors that influence the thyroid include the use of nonsteroidal anti-inflammatory medications, such as ibuprofen and aspirin, that increase the intestinal permeability, causing the leaky gut fairly quickly. With the use of these medications as well as hormonal therapy, iodine is easily removed from the system. Other medications block the absorption of iodine, such as antibiotics, we already mentioned that, antipsychotic, and antidepressants. They cause the increase of estrogens. Some foods like corn, soy, and legumes also prevent the absorption of iodine. EMFs also affect the function of thyroid, as the research finds the electromagnetic fields damage the cortex of adrenals and hypothalamus and impact the proper alignment of hypothalamus hypophysis adrenal system. Hypothalamic syndrome is becoming a more common condition nowadays. It is also known as neuroendocrinological syndrome, one of the manifestations of which could be different endocrine conditions. For example, diabetes, hypo or hyperthyroidism, hypoparathyroidism, Addison's disease, which is the adrenal insufficiency. If you live in the area with high EMFs and suffer a thyroid condition, pay attention to hypothalamus function. Also, many other chronic fatigue conditions may have unestablished hypothyroid function at their base. Natural Ayurvedic medicine effectively applies cleansing and detox techniques, panchakarma, marma therapy, and many other body and mental therapies to regulate the throat chakra specifically and all the chakras in general. Balanced nutrition and herbal formulations remove the allergens that cause the thyroid conditions, clear out and regulate digestion, and help improve the autoimmune status. So, the conclusion for all of us and people with thyroid conditions is to consider digestive wellness, along with the intake of proper bioactive forms of iodine and other minerals mentioned above. Sometimes it only takes to balance digestion in order to see results. It may be also critical to take a course of selenium for 2 to 3 weeks prior to taking iodine. If the selenium is deficient, then the intake of iodine supplements could be toxic and can lead to iodine poisoning. The favorable conditions for proper iodine processing is well regulated intestinal absorption, adequate levels of selenium, zinc, and iron. What's your digestive wellness? That is the baseline and fundamental required minimum for good health. If you become sick and absolutely must take antibiotic medications, provide support to your intestinal microflora with fermented foods or probiotics. It is important for females to check their blood for ferritin levels and levels of estrogen.